Ms. McCollum.
Thank you, Mr. Chair. Before I get into my question, I wanted to share this with the committee because I agree with my colleagues' concern on this. This is from Bloomberg News. China is selling genetically modified mice for as much as $17,000 a pair. Demand for animals that mimic human disease is skyrocketing as President Xi Jinping works to turn the country into a biomedical powerhouse by 2025. So this is something that we need not only to be addressing here in the United States, but something that we need to be addressing with our colleagues and friends of the EU and around. So good morning. Thank you for being here. And I want to go back to one of our first conversations when I asked about cosmetic regulation, or should I say, therefore, the lack of regulations. And I asked you about some of the tools available at the FDA to ensure the safety of the millions of cosmetic products on the market today. And I've been learning a little more, and I want to thank your office and others for helping us with this. Part of the problem is Congress has granted you and the UDFA very little authority to even regulate cosmetics. You don't have the ability to order mandatory recalls. You can't inspect facilities or records. You can do that with other food and drug products, but you can't do that with cosmetics. And cosmetic companies don't have to submit safety data before marketing their product. They're not required to register their facilities with the agency or even comply with basic good manufacturing practices. So even if you did have mandatory recall, cosmetic companies are not required to even report their adverse effects to you. So clearly, I think there needs to be more done. In a 2017 letter from the FDA to Energy and Commerce Chair Frank Pallone, it states that 2.9 million products were imported. Less than 1% were physically inspected. But of the products that were physically inspected, and this is 1%, 15% had adverse findings. In addition, where the U.S. has banned or restricted 11 substances for use in cosmetics, the European Union has banned more than 1,300. And I point these numbers out because it seems like we might not be giving you all the tools in the toolbox you need to do to carry out basic functions that I think the American people assume, even in cosmetics, that you're doing. One of the Office of Congressional Appropriations at the FDA in FY19 was $7.3 million, 27 full-time employees devoted to cosmetics. In 2019, little increase, $8 million, and 31 full-time employees are planned. So I'm glad to see the trending's going upwards, but at the same time, Congress had tried to pass unsuccessfully legislation that would have expanded your authority over the industry. But short of that happening, and that's something I'm going to be working with others on, are there anything that you can point to us in the 2019 budget that you're going to build on to help make it safer for consumers in the role that you're going to have with the extra employees and the extra dollars, so that we know the direction to help, due to lack of regulation, to make you more effective in protecting U.S. consumers?
Well, I appreciate the question, and you and I have had the opportunity to talk about this, and I share your concerns that there's a lot of things that we think we would like to be doing as the industry gets more modern, as more products are on the market, more diversity of products, products with more active ingredients in them, creating more potential opportunities, but also more risks. Looking at mandatory recall authority, GMPs, inspection capacity, reporting of adverse events, looking at issues with metals in tattoo inks, for example. We've seen a sharp increase in changing patterns of how people use tattoos. It's another area of regulation where we have some questions and things that we would like to be doing. I think there's nothing specific in the budget to answer your question directly. I hope you don't take that as a reflection of our lack of concern and interest in doing something. What I would say is that if we're unable to try to do something within the cosmetics program itself, my long-term plan, and we've worked this up internally, would be to move the cosmetics program to the drug center, where more and more of the cosmetics themselves have active ingredients in them, where they could be able to leverage some of the resources that we have in our drug center. I don't want to do that. I'd rather see it reside as it historically has resided within the food center, but if we can't get more resources into that program, one way to try to support it better would be to move it into our Center for Drugs.
Thank you. Thank you, Mr. Chair. I think some of the heavy metals in that I'm finding in some of the cosmetics, I think most women would be taken back because it's women who primarily are using these products, but more men are starting to use them too. Thank you.
That's right.